This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D-HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Well, I wanted to start the show by saying another blown weather forecast.
But the sun's peeking out
the
up.
sun, we understand that outside the studios the sun is peeking out. But you can be sure that the information we're giving you today here is accurate on this show. All right? Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, as the man said. She is the PhD Doctor, Executive Director, and founder of Innovative Medical Associates, located in Marlton, New Jersey. And Dr. Molly is here, as she is every week, and we will discuss the who, what, when, where, why, and how of Innovative Medical Associates and how it can potentially help you and anyone you know as far as your overall health is concerned. And, of course, we welcome your questions at any time at 855-839-1210, 855-839-1210. That is our number here if you have questions for Dr. Molly. And, again, Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. The information is all good, Dr. Molly, right?
Yeah, I try to make sure that it's relevant for folks.
Innovative Medical.
Here
and
we go.
Once again, this week, somebody said to me, are you going for your treatment today? Yeah, I go every Tuesday and Thursday. What is that again that you get?
Yeah.
I said, well, it's a lot of vitamin C, and then it's other
Nutrients.
Nutrients,
Yeah, sure.
Exactly. So,
Sure.
Dr. Molly, what am I getting? What are people getting?
Here's the deal, John. Okay. Innovative Medical Associates is actually the term we use for a conglomeration of health care providers. And all of these healthcare providers work out of my facility, which is in Marlton. So we can do anything that any primary care facility can do, and actually more than that. But that's fundamentally what Innovative Medical Associates is. Now, that being said, we have a philosophical difference in that we believe in functional medicine as well as taking care of you in terms of whatever kind of disease state you have or, potentially problem that you have that's medical in nature. I have 3 doctors, no waiting. That's the joke. And so if you come in with, let's say, a cardiac issue, and you're seeing a cardiologist, but you need some additional primary care help, well, we have the ability to do that. And if you need a prescription, are we going to write a prescription? You bet, because we do it for you. The key, though, is that we want to limit the amount of pharmaceuticals a person needs to take so that we then can limit the side effects that come about from the pharmaceuticals. But again, no one will put the patient medically at risk. I mean, we are conventionally trained healthcare providers. So if you need a prescription, you're going to get a prescription. But what we want to do is improve your quality of life, thereby maybe helping you reduce some of the need for the pharmaceuticals.
Improve your quality of life naturally, I guess would be the word, right?
As much as we can. So that being said, that's a big yardstick in that, improvement for quality of life is different. For you, for example, you want to keep rolling 7 days a week and doing 120 shows a week, and that's your quality.
Almost that many.
That is, right. But for some other folks, it's just being able to play with their grandchildren. It's being able to not have headaches. It's being able to have less fatigue. And in addition, it's able to maybe cut down some of their medication and therefore cut down the side effects that a lot of them are suffering from.
And the question you always get, you get it in just about every consultation, and people ask me the same thing. Well, does this work? And obviously... I've been going 20 years and it's worked for me. Sure. And I have a story to tell. We'll tell it later on about one of your patients I had a conversation with. But it does work. And how can you assure people that this is a way to go? This is an alternative to all the prescription medications that are typically prescribed.
And again, I'll never tell anyone throw away their medication, because medication needs to be cut down under physicians' guidance and under the nursing group guidance, and all of that can be done out of our office. So really, John, to tell you the truth, I don't have to do much persuading, because most times by the time patients get to me, they're disgusted. I call this desperation medicine.
I know you've said that many times.
Because it's unbelievable. And here's the thing. Today, medical consumers, also known as patients, are really, and in the trade, they're still called medical consumers. They're patients, folks. They're people. And guess what? They are well researched. They research. They find out that, geez, I've been having this symptom since I've been put on this medication. I don't want to stay on the medication. So they'll put themselves at harm to get off the medication. That's something we don't abide by. We want to help you do it right and make sure we augment that in a way that keeps you safe and with us a decent amount of time.
You've often said never stop your medication.
Not
and
abruptly.
a lot of people just do that.
Yeah.
I didn't like the way I felt. Oh, so I stopped it. Did you call the doctor? No.
How about during COVID? People were put on steroids, diminishing dose steroids.
Yes.
And you have to take the whole thing. Do you know how many people came in and said, I'm not taking this anymore, Dr. Molly. I feel out of my mind. I'm blown up from the... I say, stop. You cannot stop. Dr. So-and-so put me on this. And when I called him back, he said, oh, well. Okay. We help them gradually get down, taper it down, and do what they have to do.
Let's talk about your IV therapies delivered via hydration.
Yeah.
And again, I know that your protocols are proprietary and you have over 600, so you can't tell us everything, but can you give us a general idea of what is in these bags?
We use antioxidants, we use amino acids, we use other vitamins, we use minerals. Occasionally, we use doses of subclinical medication if doctor warrants it. So there's a lot of things, but the reason why we use it through the hydration vehicle is because we're able to give you a dose that's appropriate for you, and we can reach a therapeutic level, and you can feel the results of that, and it translates into doing the job.
So all of the ingredients everything is different. Right?
Correct.
Everybody's different. Everything's
basic
different.
Stuff that's in everybody, because you got to make sure you're buffered correctly, and there's all kinds of technical jargon, but don't worry about that. The main ingredients are proprietary. And
these ingredients you've often used this word synergy.
Yes.
In synergy with each other, working together to help effectuate change. And you've always talked about effectuating change.
Right. We want you to be able to work longer hours, spend longer hours with your family, feel good no matter what the condition is that you come in to see us. Look, we can't cure by utilizing the natural substances. We're not going to say that. But I'll tell you what, we have some pretty profound effects.
Interesting. I'm thinking about some cases that you've had over the years that were really bad. Yeah. I mean, these were like practically life and death cases. And you helped the patient.
We help the patient. Here's the thing. Most patients are realistic in understanding their outcome. And, one of the things that really upsets my entire staff, including the physicians, definitely Nurse Barbara and myself, is that we hate it when physicians tell patients there's no hope. There's always hope. There's always hope. And hope looks different, maybe. Maybe it means spending more time with your husband or wife, or spending time with the grandchildren, or just having a good quality of life. Maybe it's taking that trip you always wanted to do, and you have to have enough energy to do it. Well, that's what we strive for.
It's interesting because we've often talked about your protocols and how they help people. And we're going to I'll mention it now. You got a new book.
Oh, it came out on August 1st.
It came out on August 1st. God's Ingredients, TOO.
Right, two.
My 30-Year Journey in IV Nutritional Medicine. Read the book because you'll see some of the cases that we refer to from time to time here on the show are in there.
Right.
And
it's an easy read, John.
Yeah.
It's not a scientific journal article. I don't need to do that. I need to tell people that there's hope out there, and with God's help, He's the great physician. He is the great physician. And He knows when we come into the world and when we're going out. Many times people give people a sense of doom. That you're not going to find in our place.
And you've had many patients that come into you after a doctor has said, hey, look, I can't.
You got weeks to go.
Yeah, I can't do anything for you anymore.
Right, and they were with me for maybe well over 2 years.
Exactly.
Okay?
So much for that diagnosis, huh?
Correct. And you know what you can accomplish in the time that people start to feel a little better? It's unbelievable. You can reach out to people you haven't seen. You can reach out to your loved ones. You can, when they tell you get your affairs in order, generally they're talking about your economic affairs. I believe you get your affairs in order with the good Lord's help with your family, your friends, and people who love you.
Yeah. It's Health Watch is the show every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Our number here in the studio, if you have a question for Dr. Molly, and we always tell you, and a lot of folks have been heeding our advice the last few weeks, and that is call early so you don't get shut out, because at the end of the show, we have like a minute or 30 seconds to talk to you. Well, it doesn't help you. So call in early so we can spend some time with you. 855-839-1210. 855-839-1210 is our number here in the studio. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. Back here on Health Watch, as always, operators standing by at Innovative Medical Associates. And they'll be happy to talk to you if you have a question or you want to make an appointment to sit down with Dr. Molly. And that's really the most important thing you can do, because that's where you learn the most in a short period of time. Call this number, 856-489-0505, 856-489-0505. That's the number for Innovative Medical Associates, Marlton, New Jersey. And when you call, again, you can make the appointment or you can get more information. And the operators will be there well after we leave you at 9 o'clock this morning, so feel free to call then, 856-489-0505. Check them out on the web, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Let's go to the phones. Carl is in Northern Liberties. Carl, good morning. You're on Health Watch with Dr. Molly.
Hi, Carl. How are you?
Hey, good morning. All things considered, feeling pretty well.
God bless you.
Thank you, and bless you as well for all that you do. I've had two prostate biopsies, I guess, in the past 6 years, 7 years. PSA is up again, and I'm just wondering, is there anything to do other than just keep getting these prostate biopsies, which have turned out negative the first
really?
two?
So Carl, help me out. Would you consider that I understand the prostate is inflamed and hence the protein is up, right? But how high is the prostate numbers?
I think the last number was a 6, I believe.
6, okay, all right. So you've had 2 biopsies, both negative?
Both negative, thank God.
Okay, so what you have is BPH, right? And, there's much you can do for that. We're going to talk about inflammatory markers when we come back or when you get off the air. But first things first, I'm sure you're taking some supplements right now. Are you, Carl? You sound like you're smart.
I'm taking lots of supplements since 2009, A2 zinc and fish oil and ubiquinol and
good.
You name it.
Good. All right. You know what? Why don't you come in and see us? Because I bet you we can go through all those supplements, and I bet you have plenty, as you said. We probably could help you narrow those down to what you need and also utilize things like the curcumin, the turmeric, things like that. Also, some extracts that might even be more specific for these high prostate numbers. But here's the thing. You can't live and die by just the numbers of the prostate. As well, there's an old joke in the medical community that says funeral directors have seen more prostate cancer, which means guys can live a very, very long time with a prostate problem. And there's been new data that's coming out every which way about the antioxidants and about certain promodulators for prostate health. So I would definitely come in and see us. Yes, there are. I believe that what you have can be helped. Are you having a lot of trouble with your nocturnal urination, that kind of thing?
Episodically, yeah.
Yeah, okay.
I discover if I don't drink much water before going to bed, it's under control.
Yeah, but you don't want to live like that if you can help it. I would definitely come in. I have a couple products right off the top of my head that we would order for you and help you. And two of them actually come from one comes from Germany, one comes from Italy. Come on in and see us, will you? We don't bite, and we don't pull you in like they used to do on South Street. Okay? Come on in and see us, will you? You're a Philly guy. Yeah. Okay.
Do you test for nutritional levels?
Yes. Definitely. That, as well as other things like particular inflammation markers. So if you're listening to the show in the next couple of minutes, I'm going to be talking about two in particular that they don't test for normally. Okay?
All right, Carl.
Come on in.
Thank you for the call. Good luck with everything, all right?
An interesting thing that Carl said, do we test on a nutritional level? Of course we do. Of course we do. Most functional medicine people do. They'll run a test and see exactly where your levels of vitamins, minerals, those kinds of things are. Intercellularly is the important piece, not just outside the cell. What we want to know is how the cell is taking up that. But those tests do tend to be a little bit costly, and so I try to limit. I want to make sure that we're doing the patient a service by doing that. He's right to ask about that, in particular because he's taking so many nutraceuticals by oral levels, and it would be interesting to have a starting point because he'll find that after a few IV of the same nutraceuticals, his cellular level will be higher.
Because you can't get the dosage that you're getting in the IV. I knew that.
I think that's what's happening.
Right, okay. 855-839-1210 is our number here, and again, it's Health Watch Sundays, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly, I know you wanted to talk about this. You just mentioned it. Inflammation, and I know you've always said inflammation is the culprit.
Yes,
is the culprit.
It's
yes.
the devil.
Yes.
And inflammation is good, right? It heals cuts, trauma, that kind of thing. But inflammation that goes haywire is bad. One of the things that recently I've been doing a little work in, because, I get all the science journals as well as, the traditional journals that primary care would get. So 2 items have come up, and something that I'm very familiar with is interleukins. You've heard me speak about these before. They're proteins strung together that can be necessary for good health. And there are 2 interleukins in particular lately that I've been looking at, interleukin 6 and interleukin 13. And these interleukins, when they are high, when they are too high, they're out of whack. Just like everything else I talk about, you want them to be just right, the Goldilocks theory. So, yes, I'm looking for these. And interestingly enough, they are high during inflammation, in particular for certain autoimmune diseases. For example, certain cancers have high numbers of interleukin 6. Certain cancers have high levels of interleukin 13. But if these numbers are high prior to you actually developing tumor, wouldn't it be good to get them under control?
Absolutely.
The answer is yes,
Sure.
Of course. You're a smart guy, John. And how would we do that? Well, we would monitor these 2 particular interleukins ongoing while you're doing some IVs in our facility. And again, this is not a test that's done often in traditional practice. It is done sometimes in cancer practices. But you know what? we need to look at you before you get full-blown cancer, right?
Right.
So I'm going to monitor these as we go on. And they are affected by antioxidants can bring them down, curcumin can bring them down, anti-inflammatories can bring them down, and your old friend vitamin C can bring them down. So here's the thing. You want to continue to look at your interleukins. And as you know, I use some products from Italy that are very interesting in doing just that, physiologically re-regulating your interleukins so they're not so high and become pro-inflammatory.
That's fascinating.
It's very complex. I'm trying to make it as simple as possible. So you want to work. This is working on a molecular level. In other words, we're looking at the body, at least I do. My docs look at you like, hey, you come in, you have a cold, here, you have bacteria we want to treat, right? They want to treat. But when I'm looking at you on the biochemical level that God's hand's involved in. Okay, here we are. You have these strings of proteins. The idea is you've got to keep them under control.
And that's part of
what
you're
process,
doing. Right,
of course. And we see them going up in various conditions. Absolutely. The newest paper that came out showed that interleukin was found in lots high in all the pulmonary issues of people who had COVID-19.
Oh, that's
Is that unbelievable?
Yeah.
And they're doing this. So the research scientists have found this. Well, guess what? We knew, in terms of myself and people who do what I do, we knew that interleukin 13 is a very pro-inflammatory interleukin if it goes too high. And we knew before COVID-19 that it would affect your lungs. So what do we do in my clinic? Well, when I'm putting together your nutritional IV, we're going to look at what can affect the interleukin 13.
How can people find out more about what you're talking about, interleukins?
Well, go on the web and start looking, but they're mostly science abstracts.
Right.
So, look a little bit and then call me, talk to me. Come in and see us. We'll talk to you about this.
I was just going to say,
But you know what? Here's the deal. I want to keep organic chemistry simple, stupid. All right? That's it. Okay. Because you can go out of your mind because there's relationships between all of these. Interleukin 6, obviously, they're numbered, right? The interleukins are numbered. Well, there are many of them. And they all have certain jobs because they all string these proteins together and they work in various organs and systems, more importantly, in the body. So the idea is, wouldn't it be good to just bring the body back to homeostasis, which means balance, Goldilocks, right in the middle, not too big, not too small.
And in the end, that's ultimately what you do.
Exactly. That's what I'm getting at. Yes, I want to talk a little bit about the science, that there are things we're looking for. But honestly, it's bringing the body back to homeostasis. And I would tell you that that's something we really work to do no matter what the condition is.
Just remember, you are the scientist who had the chemistry set at 5 years old.
Yeah, that's true.
The rest of us are mere mortals.
No,
okay?
No. I've met a lot. Listen, my patients, our patients, are very intelligent, very well-read, and get it.
And a lot of them do. And I've talked to them. Right. I've talked to them, and they start telling me things. I say, wait a minute. Where'd you get this from?
Yeah.
And they'll say, well, Dr. Molly said, okay, that's good enough for me.
No, come on.
All right, we're coming up on a break. After the break, we're going to talk about a brief experience I had in Dr. Molly's facility with a discussion with a patient, and I found it a really very interesting and informative discussion, and it relates to a lot of things that we're talking about here on the show. And we're also going to talk about Dr. Molly received an email, which sounds like about 100 other stories that she's had in her in her career. So we're going to talk about that and whatever you want to talk about. You have a question for Dr. Molly, you have a particular medical challenge you want to run by her, it's 855-839-1210, 855-839-1210. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia, the PhD doctor, executive director, and founder of Innovative Medical Associates. I'm John DeMasi. We return. More Health Watch today after these words. Back here on Health Watch, and as always, operators standing by at Innovative Medical Associates, and they will be there well after we leave you at 9 o'clock. What do you think? They go to the beach? No, they're there. All
Not
right.
today, anyway.
Not today. They're there. They're there all day. 856-489-0505 is the number. 856-489-0505. It's the number for Innovative Medical Associates, Marlton, New Jersey. Call that number. In fact, you can call during the week if you like. That is the number for Innovative Medical Associates. And you want to sit down with Dr. Molly, go over your issues and situations. As a matter of fact, this week I was there getting my regular treatment, and someone from the radio show came in and was talking to Dr. Molly. So it's
that's right.
It's like it's happening all the time.
Of course.
So feel free to call 856-489-0505. And remember the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Again, if you have a question right now for Dr. Molly, you can call right here in the studio, 855-839-1210. So I wanted to tell this story. You have a relatively new patient.
Oh, yes.
And, you know, typically I kind of see an age range. And I thought to myself, she's very young. I mean, she's probably barely over 30.
I would say that's true.
And you know, she's sitting there, and we start talking, and she said, yeah, I've been coming here for a little while. And I said, well, what's your issue? She said, post-COVID.
Yes.
She said, I had COVID, and she said, I just couldn't shake it. Right. And she said, until I came here, she said, now I feel like I can function. And she has a little girl, like 6 years old.
Oh, yeah, she's cute,
Right.
cute as anything.
Right.
Yeah.
I'm thinking, well, you know, that takes a lot of energy.
Right.
And she said to me, how long you've been coming here? I said, 20 years.
She went, wow.
And I said, I always felt like during COVID that I was protected because of the immune system being boosted with vitamin C and the other nutrients that you've used.
Sure.
So I said, you know, it would have been nice if you came earlier. She said, yeah, but unfortunately, I didn't know about this place. Interesting, though.
It's an interesting thing, and it is true. Look, I don't want people to be cavalier about all of this, right? But, you know, here's the bottom line. How many times have I said, it's your immune system. This is what's going to kick in. God gives us an innate ability to really go after things like viruses, bacteria, and things like that. But the question is, how tuned up are we? Look, age, work, stress in particular, you know, as we go on through life. You know, your immune system, unfortunately, has been working 24/7 since birth.
Yes.
All right. So why not go in and get a little high test? Or if you believe in Tesla, plug in your car.
Right.
I mean, bottom line, this is what we need to do. And John, I mean, I can't stress enough. Look, as they're talking more and more about this COVID again and resurgence and all of that, obviously we have to be careful, you know, listen to your inner voice, but I'm telling people they must keep their immune systems in good working order.
And we talked about that many times during COVID here on the show.
Exactly. My godson is a good example of this. He comes in now, and he's a cabinet maker, as you know, and you know he's a good friend. He works for Harvey, who's another patient of mine.
And who's become a good friend.
Right. Yeah. He really is a young man. He's suffering now from post-COVID, long hauler, and he said, you know, his wife works for a big health system, and she insisted that he go to the new specialist. And guess what the specialist does? She's a post-COVID specialist. Okay. Now, I'm going to make you laugh, because what is she doing? She put him on a ton of vitamins and things that I already have him on. And he laughed. He said, I don't really need this. He said, I'm worried about my endocrine system to her. She goes, oh, well, that's not in my field. You need to go to your urologist. Okay, and guess what? I agree that he had to go to a urologist. She goes, yeah. He said, Dr. Molly already sent me. And indeed, I'm being supplemented with testosterone because it has affected that.
You know, I thought that we'd talk about this because it's interesting with all the talk now about the Delta variant and masking and so on and so forth.
You know, okay.
and that's okay.
Yeah.
But keeping your immune system
in check
and boosted like the vitamin C does and other things
exactly
is really the way to go.
Wouldn't it be nice if we had the same thing they have in all these new cars that now come on and tell you check engine light, right? check engine light.
Yeah, we have a caller, and we're going to go to the Great Northeast. Jim, you got to say the Great Northeast. Okay. Tim is in the Great Northeast.
Hey,
Tim, good morning. Welcome to Health Watch. You're on with Dr. Molly.
Hey, Tim.
Yeah, hey, good morning, everybody.
Hey.
Dr. Molly, I've been prescribed a medication by, an endocrinologist because of a nodule in my kidney, he says.
Yeah.
And it's called something or the other. I got it right here.
Okay.
It's spelled, I must be losing it.
So what this does is it's to control the blood pressure and things that are affected from the kidneys, and ACTH or something like that.
Yeah, that sounds exactly what he said.
Yes, good.
And
okay.
I'm just a little wondering about it because
listen, yeah, I'm with you on that. It's interesting. The nodule is it fairly large? Do you know how big is it?
Very tiny, he says.
Oh, okay. You know what would be interesting?
Wow. I mean, I think it was first detected over 7 years ago.
How about that?
I was on potassium-sparing medication.
Sure.
And then the cardiologist took me off of it. Now this guy wants to put me on something else.
I got you. How's your blood pressure been, my friend? Good?
Well, I'm on 10 milligrams a day of amlodipine, and since 1981.
Okay.
And it's been relatively good. I check it myself at home and the doctor's office.
All right. Sounds right. Listen, Tim, how old are you? Just a real quick question, too. How old are you? Okay, you're a baby. All right, listen to me. Come and see us, and also maybe call my office. I might put you on a probiotic specifically for the kidney, and in addition to that, I might talk to you about some possible procedure, but I need a little more information, and I can't do all that over the phone here. But call the office. Come on in and see me in person. Okay, that we won't bite you, and yeah. Okay.
Can you talk a bit about restorative sleep?
Oh my goodness, yes.
After 10 years on a CPAP. That's it. Thank you.
You're a
Tim,
nice
thanks
guy.
for the call.
Hey,
good luck with that.
Tim's a nice guy. Restorative sleep is very important because what happens? The body actually repairs itself during that period of time. But I have a couple little pearls for Tim if he comes in and sees me in person that I can't talk about here on the radio. But it's interesting. Restorative sleep, the way he put it, is exactly important because many of your biochemical processes are being, let's say, re-regulated during the sleep cycle. And it's really, really important to do that. The question is, what sleep nutraceutical is appropriate for you? And that can also be done by possibly taking a good history that the doctor would do. But in addition, there are some tests that we can do to look at the neuroamino acids that are going on in the brain and then supplement or take away depending on that.
We were talking about COVID right before Tim called in, and I wanted to ask you, and I'm sure you do, you have a protocol for those who are saying, well, I don't want the vaccine, or I have the vaccine.
Oh, sure.
I want to be sure that I'm safe from getting the Delta variant. You have a protocol for that?
Here's the thing. Is anyone safe from any variant?
No.
The only way you are safe is if your God-given immune system is tuned up to the best that it can be where you are in your stage of life. Okay? Obviously, your immune system is under assault every day. If you have an autoimmune disease, if you have cancer, if you have inflammation like in your joints, your immune system is being assaulted daily. So it's almost important. Now, I have a wonderful patient, Sandy, who has autoimmune disorders and a lot of joint and pain, knee pain, etc. Do you think her immune system is right up to par to get through COVID?
Probably not.
No. But what does she do? She never got COVID, God bless her, and she refused to take the shot because she was worried that the shot would promote more of her joint problem. Smart lady,
yes,
right? Okay.
Yes.
Good woman. What does she do? She comes in twice a week. She moved from going from once a week to twice a week, and she said, Molly, I'm feeling okay. I feel secure from the COVID.
And that was my point, that with all that's going on today, there's a way that you can help people.
Help people. I can't, can I say absolutely it A, cures COVID, and B, is going to keep you from getting any of the variants or keep you from getting the flu? I can't do that, but I can tell you that you have a better shot at going through this by keeping your immune system at its highest level for you.
Which was my original point to your patient. That I always felt like I was in really good shape.
Sure.
And the immune system was at the maximum.
Right. But you're not nuts either, John. No. You're not running around and, taking other people's tissues and things like that. I mean, look, we can't legislate cleanliness, John.
Yeah,
we can't do it.
You're absolutely right. And I thought the same thing.
Amen.
You just can't. We are coming up on our final break of the morning, and that means you still have time to jump in on the show if you have a question or a medical challenge that you want to run by Dr. Molly. 855-839-1210 is our number here in the studio. 855-839-1210. We're going to come back with a call from Shirley in Lindenwold, New Jersey, and maybe we'll talk to you as well at 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. More Health Watch after these words. Back here on Health Watch, again, operators are standing by at Innovative Medical Associates, 856-489-0505. You call, and you've heard Dr. Molly say, look, come in for the free consult, and I've got some things I can talk to you about, and I can help you. Hard to diagnose on the radio, so that's really why she says that. So why don't you make the appointment, 856-489-0505. That's the number, Innovative Medical Associates, Marlton, New Jersey. They'll be there well after we leave you at 9 o'clock this morning. Listen, they work hard on Sunday, all right? 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you miss any of today's show or you want to hear it again, we have our Health Watch replay 4 until 5 this afternoon, right here on Talk Radio 1210 WPHT. This, of course, is our live version of Health Watch every Sunday, 8 till 9. Let's go to the phones. Shirley is in Lindenwold, New Jersey. Shirley, good morning. You're on Health Watch with Dr. Molly.
Hi, Shirley.
Hi, good morning, John and Dr. Molly. Dr. Molly, I had some calcification removed from my left leg, and I went back for another checkup, and he said the blood vessel above the knee is 50% blocked. Now, if I may, I would like to give you a list of the nutrients that I'm taking.
Yeah, go ahead. Go ahead.
I'm taking turmeric, grapeseed. I'm drinking Earl Grey tea, bergamot, olive leaf, alpha-lipoic acid, B-complex, and black seed oil.
Okay.
Vitamin D and magnesium. And I also have iron overload.
Now, you have iron overload? So did they tell you have a form? What did they call that? Just iron overload? They gave
hematosis.
Hemochromatosis.
Yes.
Okay. Yeah, now we're cooking. All right. So you have to be careful about what kind of vitamins you do take. Absolutely. All right, because you don't want to promote more iron in your blood. And again, I want to say, Miss Shirley, you know what? Here it is, the Goldilocks theory, just right. Not too much iron, not too little. But that being said, it sounds like you're taking some anti-inflammatories, and they're good for you. But I think what you really need is some chelators, things that will claw out the calcium in your blood and open up that vessel. And unfortunately, generally, after you've already had the surgery, he's reduced some of the micro vessels in your body, and it's something I didn't have time to get into today, but I was going to. So God works in strange ways, and that is also contributing to this. In other words, you may be getting enough blood flow now that he opened up one of the vessels, but if you still have the calcifications above that, you're not getting enough to the knee joint and that kind of thing. So I think you need a chelator in addition to what you're taking. So come and see me, and we'll talk about chelators. Okay, dear?
Okay, will do. Thank you.
God bless you.
Shirley,
thank
you for the call.
God bless you.
A chelator is
something that claws out or junk takes out the calcium. And what we're trying to do is not take out the blood calcium that we need for strong bones, that kind of thing, but the excess calcium that has blocked certain arteries and has sort of put an burden in that area.
Very similar to what you've often talked about with heart issues.
Yes, of course. And in this case, I would say it's interesting because lots of times it's microcirculation that gets affected by these calcifications as well as the large vessels.
Okay, let's talk about this email that you got.
Oh, sure.
And this is sort of, I mean, this story has been repeated over and over, not only in your clinic, but here on the radio.
Yes.
You've told stories. Someone emailed you and said that various physicians couldn't diagnose her.
Right.
But
she's
so
still
what's the story?
feeling all of these symptoms: pain, extreme fatigue, headache, just overall muscle spasms, this kind of thing. It sounds to me like she has a multifaceted autoimmune disorder, which means she may, as I don't know how else to put this except to say, she probably has some dysregulation that would fall under one type of autoimmune, but in this case, she has a multi-level. So it looks like she may have lupus. It looks like she has MS. It looks like she has fibromyalgia. But they can't make a definitive diagnosis for any of those because she has multiple symptoms that could fit each and every one, right? But not 100% of one. So how do I see this every day in our clinic? And what is the nature of what we do? Well, we're functional medicine people. So my thing is, maybe the diagnosis per se isn't that important as knowing that the symptoms she has all points to autoimmune inflammation. Totally. So it's not a particular group of symptoms, but it's all of them that is causing her problems. So I would then look at, in addition to what my physicians would look at, I would look at, let's address her symptomatology and improve her quality of life.
And so it's hard to diagnose because, as you said,
she may not fit
right.
one category, and that's the interesting thing. She may have overlap. I have patients that don't have MS per se, but they have MS-like symptoms. So guess what? They have a touch of MS? I don't think so. You don't say it like that.
No,
what they have is autoimmune dysregulation, and that's important to get under control.
So what would you do with this if she becomes a patient? What would you do?
First of all, I'd have her checked out by my docs, and the next thing I would do is put her in an autoimmune program of hydration that would include the anti-inflammatories to address some of the inflammation. I would probably look at the antioxidants, which would include vitamin C to improve stamina, that kind of thing. I probably, depending on if she had some other type of symptomatology, I would probably use vitamins, minerals, as well as the amino acids.
And ballpark, what would it take? How many treatments in your facility would it take?
In this case, I would say, depending on how long she's had this lack of diagnosis but has had these symptoms, probably 30 treatments, which would be 15 weeks.
Yeah, okay. But that's a start at least.
Yeah, exactly.
Which right now she's kind of in limbo, right?
Right, exactly right.
Yeah.
And we're going to address her email, if not this afternoon, certainly tomorrow morning.
Okay, real quick, we got a couple of minutes left of the show. I know you wanted to talk about your skincare line.
Oh, yeah.
And some folks were concerned about some things.
Yes, okay. Because everyone is affected by the reduction of collagen production as is affected by age. Well, yeah, okay, I agree with that. I actually have a whole program that addresses that through the hydration therapy. So part of the thing is when you have low production of collagen, which is age related, you have low antioxidant levels. So we then give you antioxidants in the bag along with collagen itself, okay? You have too much sun damage. All right, which we know you should definitely keep applying your sunscreen. Don't just put it on in the morning and forget about it.
Every hour, right?
Right, and also use it during the winter. How about you're following the low-carb, newest craze, the low-carb diet, right? When you follow those low-carb diets, what do you cut out? fruits. Many times so what are you cutting out? Your vitamin C, right? Which you need to get replenished.
Exactly.
And then there's a need for high quality protein, all right, which is very interesting because the body has 20 different amino acids in the body. However, it can only produce itself 11 of those. You hearing me?
Yeah.
So the other 10 have to come in. The other 10 have to come in, sort of. The other 9 rather have to come in from outside sources. Well, how do you do that? Well, we can deliver them. And people who are big athletes know that because they come in and get what? IV amino acids all the time. So I'm telling you that dehydration is also a big problem. So, okay, you're not drinking enough, you're never going to get plumped up in the collagen area. So again, use some of our natural products, but I would say also come in for a short course of hydration.
Okay, well, guess what?
No, we're not out of time. Man, I had a whole other segment to go to.
We're out of time. Well, save that for next week, okay?
You got it.
All right. That's going to put the wraps on another edition of Health Watch. Don't forget, if you missed any of today's show or you want to hear it again, we have our Health Watch replay this afternoon from 4 until 5 here on Talk Radio 1210 WPH.D. You want to set up an appointment with Dr. Molly? Operators are standing by. They'll be there well after we leave you at 9 o'clock at 856-489-0505. 856-489-0505 is the number. And don't forget, check us out on the web, innovativemedicalassociates.com, innovativemedicalassociates.com. As I said, that's going to wrap up another edition of Health Watch for Dr. Molly Fantasia and everyone at Innovative Medical. The lovely Linda, Joanne, Barbara, fabulous Fran, delightful Dee, and our nurses Jess and Crystal. I'm your host, John DeMasi. Thank you for listening. Always a pleasure. We'll do it all over again next week. Health Watch 8 till 9, Talk Radio 1210 WPH.D. You take care.